Can I begin by thanking you all once again for your attendance here tonight. A fundamental objective of the O'Farrell government's agenda is to continue to liaise with the key stakeholders of various portfolio areas such as yourselves, and through this participation develop better ideas and policies which will complement the important areas of service delivery for which we have responsibility. There can be no more important area to focus on than that of health, and it remains the highest priority of our government through the decision and leadership of our Minister Jillian Skinner, who I might add has held the responsibility for health both in and out of government longer than any other representative in this field. Our Premier Barry O'Farrell made the commitment that our government would deliver the necessary funding and services for New South Wales on a needs basis, not on a political basis, which had previously been the case. And there can be no greater example of the genuine intent of that comment than the commitment to invest $300 million of funding into Blacktown Hospital, an area our party will never represent, but a facility located in an area so vital to the health services on behalf of the tens of thousands of families spread across the greater region of Western Sydney. One of the first acts of our government was to implement local health districts, which devolved decision-making and re-engaged medical professionals and put patients back at the centre of every decision. The government did this because the system of over-centralisation had added layers of bureaucracies and had failed. The purpose of today's forum is to listen and gain feedback about the direction of health services in Greater Western Sydney. As Parliamentary Secretary for Western Sydney, I work closely with the Premier, and together we represent an incredibly diverse and rapidly growing area where 1 in 10 Australians currently live. One of the key drivers of population growth in Western Sydney is the new births, and the most recent New South Wales Mothers and Babies report showed a 6.4% increase, with over 96,000 babies born in 2009, an increase from 90,000 in 2005. It would come as no surprise that the largest increase in births was in Sydney's west, where they increased by almost 13% during the same time. The high birth numbers, coupled with significant growth in housing, results in increased demand for health services and the need to carefully plan for the future. To support this demand, the construction of the $300 million upgrade to Blacktown and Mount Druitt Hospital is expected to start in 2013 and includes the new comprehensive cancer centre and additional inpatient beds. The $139 million redevelopment in Nepean Hospital, jointly funded between the state and federal government, includes new operating theatres, an expanded intensive care unit and a new oral health centre. But perhaps the single most important issue residents of Western Sydney raise is the need for additional parking at our hospitals. And we know that visitors are so important to patients and assist with their recovery, which is reflected in patient reviews. Additional parking facilities are now funded at Blacktown, Nepean and Liverpool hospitals, and further parking is planned for Westmead Hospital. It is also important to remember that every local health district received significant growth in the recent funding allocation in our budget. This government has taken some very tough decisions over the first 18 months in office, and we will continue to make tough decisions in the future. But the people of New South Wales can rest assured that the decisions our governments make are in the very best interest of every person in New South Wales. Today's forum is an opportunity for local health boards who are represented here today, as well as the Minister, to listen to your concerns and receive your valuable input. In closing, I would like to thank you all once again and encourage you to participate in discussions with the expert panel here tonight. And ladies and gentlemen, could I ask you to join me in welcoming the Minister for Health, the Honourable Jillian Skinner.